Good morning, good afternoon, good evening, depending on where you are, although I think that's less likely. My name is Wendy Nelson. I'm a health science administrator at the National Institute of Health, and I'm also at the National Science Foundation. I'm welcoming you to the Mobilizing Research U2C Technical Assistant webinar. Mobilizing Research is a collaborative project that's developed through the NIH's mHealth Working Group. This RFA, OD-15-129, is a joint funding project with the Office of Behavioral and Social Sciences Research, the National Heart, Lung, and Blood Institute, the National Institute on Alcohol Abuse and Alcoholism, the National Institute of Biomedical Imaging and Bioengineering, and the National Institute of Neurological Disorders and Stroke. As you all have the complete RFA, we thought that we would use this time to highlight key points and questions you may have encountered. If you have questions, please hold them to the end. This will be a brief presentation, and you can email me questions if you think of them during the talk. My email is nilsenwj@od.nih.gov, and it is on the screen in the notes section. So we all know the potential of mobile. It's developing exponentially around the world. mHealth includes cell phones, sensors, and devices that are usually carried on the person and that transmit information wirelessly. This also includes diagnostic and clinical decision support tools that healthcare providers use. In the U.S., 91% of adults have a mobile phone. And importantly, smartphones are growing fastest in African American, Hispanic, and low-income homes. Mobile provides an economical way to collect continuous data from people we could not previously reach and ask questions that we were never able to ask or conceive of before. Remote collection of real-time continuous data has the potential to advance research, prevent disease, improve diagnostics and treatment, reduce disparities, and increase access to healthcare services, as well as lower healthcare costs. So there are many examples of mHealth, but most lack rigorous evaluation. Thus, the science hasn't kept pace with the excitement in this area. So the time is now. Mobile technology is at a tipping point, and the time is right for the science of mobile health to really take root. This is where this opportunity has been announced. There are many challenges in mHealth, and you can read the challenges on the slide, but I just want to highlight a couple that have driven this announcement. One, it's very costly and time-consuming for researchers to work with incompatible devices, such as Android, iPhone, feature phones with multiple carriers. This means they have to develop interfaces for multiple cellular platforms or buy participants' phones. Further, they have to work to negotiate contracts, changes, or additions. This requires time and money that's repeated anew for each trial. It's expensive and challenges scalability. Interoperability is also not yet realized, and we realize there's very little incentives for being able to work across devices and operating systems. The rest of the opportunities are common across trials, but in mobile, we have an opportunity to spark change. So overall, the goal is to create a self-sustaining mobile health or mHealth infrastructure. It's simple yet comprehensive. Ultimately, we will have a fully functioning mHealth research infrastructure that greatly reduces the time and cost of research in this area while greatly increasing its scope, reach, and scalability. This should quantitatively and qualitatively transform research and really change the questions we ask and the designs we can employ. So the purpose of this RFA is to support the development of a mobilizing research resource that would allow research to more efficiently and rapidly evaluate mobile and wireless or mHealth technologies. This research resource is intended to develop an infrastructure that creates a registry of potential participants to facilitate mHealth research across a variety of observational and clinical research studies and settings and for a range of diseases and populations. This RFA supports mobilizing research for the development of the infrastructure and a transition to sustainability. Therefore, the proposed integrated and centralized research should be designed and operated in a way that will facilitate and enable its sustainable functioning in the near future. The infrastructure is expected to be disease and population agnostic, thus it should facilitate research across conditions, ages, and populations. So let's move to the application specifics. Eligible organizations, and please note this is all in the RFA. Eligible applications are listed. They're also listed on the slide above, and I'll add that in addition to those listed, the following types of higher education institutions are always encouraged to apply for NIH support as public or private institutions of higher education. This includes Hispanic serving institutions, historically Black colleges and universities, tribally controlled colleges and universities, Alaska and Native Hawaii serving, and Asian American Native Pacific Islander serving institutions. We also have eligible organizations in governments, state, county, city, or township governments, as well as some special districts, Indian, Native American, and eligible agencies of the federal government, as well as U.S. territories and possessions. Unfortunately, foreign institutions are unable to apply for this announcement. That said, there may be a U.S. applicant that partners with a foreign institution to provide a global focus. We would hope that if mobilizing research is successful, a global component would be developed because of demand. The application process. The letter of intent for RFA OD-15-129 is due April 8, 2015. The letter of intent is not a requirement nor a binding document, so you can do the letter and then decide not to apply later. The value of the letter of intent for NIH is that it helps us plan review for providing information about the size of the applicant pool and identifying which PIs and institution are likely to be in conflict. The next step after you've written your letter of intent is compiling the application. All applications use the SF-424. For additional information, please use the resources listed on the screen. You also need to follow the instructions for ASSIST, which is for multi-component applications, and that too is listed on the screen. These slides will be available after the webinar. The slides will be available after the webinar. They will be posted on the Office of Behavioral and Social Sciences website, and I will send everyone on this call an email as well as post it online that we have them. So the applications are due. The applications are due May 8th, 2015, and we plan on reviews and counsel being completed so that we can be funded by September 2015. So we're going to talk a little about the application components. All applications consist of the following components: an overall section, which is used to describe the applicant's vision for the program and highlights how the other cores fit together. The administration core, which highlights how the U2C will be managed, and the research core, which is where the applicant actually describes the mobilizing research system. Page links are listed on all three required sections. Overall is 12 pages, administrative core is 6 pages, the research core is 12 pages. On the overall section, mobilizing research is going to serve as an mHealth resource to the mHealth research community, allowing them to efficiently recruit, conduct studies, and collect data using a rapid and reliable system. The mobilizing research infrastructure will support scientific discovery by bringing a common structure and language to mHealth research by providing researchers with a streamlined system that has minimal respondent and researcher burden and cost, as well as a database for harmonized data collection. To ensure efficient performance of these activities, the mobilizing research structure shall allow for continuance and expansion of the current research structure supporting mHealth, including an overview of software, security and backup, database, and analytic capabilities. So what we're asking you to do is to describe the applicant's background and progress in this area. So we'll briefly summarize previous experience with research recruitment, databases, and interfaces, and with web-based platforms needed to deliver a system for researchers and participants that works through mobile devices. So you want to summarize how Mobilizing Research intends to meet the objectives of this RFA and identify the selected areas of focus and strategic goals related to creating a rapid and reliable recruitment research system. This includes overall, which is of the components, plans for strategic oversight and coordinative effort among components, and a plan for collaboration and coordination with the broader mobile research community. This section also includes letters of support agreement for any collaborative, cooperative arrangements, subcontracts, or consultants. This section also includes a data sharing plan. The administrative core will provide overall administrative and organizational oversight and management to the Mobilizing Research resource and the usability and the resource core. It also serves as the primary interface between the program and the research community. As part of this section, the applicant should address the following: overall leadership and personnel capacities. So administration, operations, meeting support staff, business or other legal expert staff, and other staff that are required for the Mobilizing Research program as a whole. We also are looking for support for internal evaluation and self-assessment, including the ability to generate progress reports, ability to assess and anticipate researcher needs, and ability to prioritize and incorporate improvements into operations and software that enhance its utility for research. Anticipated challenges and obstacles and alternative strategies to surmount potential obstacles. So how can you work when things get difficult? The next section is the resource core. It's 12 pages, and it will describe the development of Mobilizing Research, including usability and feasibility, the capacity to address system standards and upgrades, training and outreach, strategic planning, and the development of a public-private partnership model of sustainability. The applicant should describe the following: the overall vision of Mobilizing Research resource core and its components, overall approach and methods to establishing a data portal for user-friendly access to data, both raw and processed data sets, metadata and visualization tools. This web-based interface should provide controlled access to both Mobilizing Research participants and the broader scientific community, and now enable federation to relevant external databases and data resources, and the ability to allow researchers to, it should also allow the ability for researchers to identify the demographics of a target population for a given study, the ability to allow participants to identify ongoing research, and the ability to generate participant and researcher portals that are created with user-centered design principles. Portals should contain wikis for reporting research findings and updates. Research core continued. The resources should also have the ability to export data consistent with data interoperability standards, including HL7 capability for integration into electronic health records, or EHRs. It should also have a proposed process for creating a resource with the capability to store and aggregate all primary and process data and associated metadata generated by the mobile health research community that is using Mobilizing Research. Of course, it will also have the ability to ensure data security and maintain confidentiality of personally identifiable information. Importantly, too, the core will also describe a series of feasibility and usability tests that progressively assess the functioning of the system before it is available to the broader research community. It will also have online training modules and tutorials for data access and visualization by a variety of users, naive users, computer scientists, researchers from a variety of disciplines, It'll have self-administered methods for researchers to distinguish among the tools in the system and to determine which tools are best for the study. And it will have a description of server maintenance, software maintenance and upgrades, and security and backup processes. The research core also includes technical capabilities and strategies for designing the data repository and management systems in such a way to maximize sustainable functioning in the future, even under limited or no funding. If it's appropriate, describe plans. We ask the applicants to describe plans for a public-private partnership, a PPP development, including but not limited to the ability to devise, implement, and adapt the business plan on a quarterly basis, but also to the generation of additional funds in years 4 to 5 to replace NIH funding, as well as revenue generation beyond year 5. And our last slide for the research core is sustainability. Sustainability is key. So applicants are asked to describe either a potential to leverage existing or anticipated partnerships with private entities capable of establishing a PPP, or an explanation of why a PPP is not applicable and what other sources of revenue will allow the mobilizing research system to be fully sustainable without targeted NIH funding by 2020. So as a part of this section too, the applicant should address the following aspects. They're going to want to talk about the personnel capacity. We're going to talk about operations management, customer support capacity. It may include the following: basic technical support for investigators participating in mobile research, communications channels, phone, email, web-based content such as frequently asked questions and other appropriate mechanisms, and the ability to refer more technical staff or issues requiring more detailed knowledge of programming, database, statistical, or bioinformatics approaches, etc. After you've submitted your review, a special emphasis panel will review all of the proposals with the criteria clearly listed in the RFA. All 3 cores will be scored with the listed review criteria. I will go over a few of the review criteria for the Mobilizing Research Resource Core, and I will cover a few of these. First, does the director and staff have the needed experience? Are the data plans adequate? Are the interfaces and tools planned appropriate for people to access standards? Is there a sustainability plan? Further criteria include, will the tools develop support interoperability with deposited data and other databases? Will the environment contribute to success? Is the institutional support for the project adequate? Are the proposed personnel, resources, and organizational structures adequate for success? And will the project benefit from the unique features of the scientific environment proposed by the applicant? This is a cooperative agreement, and cooperative agreements include steering committees, and they also include an NIH project scientist that will have substantial programmatic involvement that's above and beyond the normal stewardship role in awards. I will just describe it briefly. The person will participate as a voting member in the Mobilizing Research Executive Steering Committee and will invite members of the External Advisory Board to serve. The NIH project scientists will help plan and carry out mobilizing research activities and will participate in all reports. They will act as a liaison between the mobilizing research team and the NIH. Additionally, an agency program official will be the normal scientific and programmatic stewardship of the award and will be named in the award notice. There's an executive steering committee. The principal, investigator, and any co-PIs must agree to participate in an executive steering committee that will meet twice each year. The Executive Steering Committee will consist of the Mobilizing Research Team, the NIH project scientists, the NIH project official, relevant HHS regulatory agencies such as the FDA and the ONC, and mobilizing research personnel as needed. If voting is necessary on an item, the Mobilizing Research Center and the NIH hold one vote each. The chair will be chosen from amongst the members. The purpose of the Executive Steering Committee will be to discuss and evaluate concerns and cooperative activities of mobilizing research. The Executive Steering Committee may form and charge other subcommittees as needed. There is also an external advisory board. Mobilizing research PIs must indicate their intention to be responsive to recommendations provided by an independent external advisory board. Members of this external advisory board will be nominated by the Executive Steering Committee in collaboration with the NIH and will be invited by the NIH. A chairman will be chosen among the 4 to 5 members who will be accomplished senior scientists from academia and industry with backgrounds in mobile health technology, databases, and devices. The Executive Advisory Board will meet annually in conjunction with one of the semi-annual meetings of the Executive Steering Committee to review interim progress of mobilizing research and provide an annual report and recommendations to the NIH and the Executive Steering Committee. The contacts for the RFAs are listed above. We ask that you not contact all of us individually. If you want to ask a question and you want to email one of us, that's fine. But if you want to email all of us, please email us together so we do not all have to respond to the same question. I want to review some of the questions that have been coming in. I know many of you are waiting for this webinar to do it. But the first question we have is, the funds available listed in the RFA and the award budget do not match. Can you clarify? We have $2 million per year put aside for this effort. Applicants can request up to $1.25 million per year in direct costs, with indirect costs that will roughly match our $2 million a year. Another question is, the RFA mentioned recruiting through carriers. Is this a mandatory requirement of the grant? So the need for outreach through the telecoms is not a requirement, but when it was actually offered by the telecoms. We had at the MThink meeting at NIH. This included Verizon, AT&T, and GSMA, which is Global Mobile. And the link for the MThink is there. What we are looking for is any approach that can gain the participation of a representative population sample for the registry. There's also a question about what foundation for this project has been put in place at the federal level. Were there other agencies like the FCC, FDA, USDA also involved? And this is not an NIH-only effort. The project's been developed with the help of many of our sister agencies. They will continue to be involved as the project goes forward. So now we are at our time for questions. You can email them to me if you'd like, or you can type them in the question box and we can answer them. All of these questions will be listed on the OBSSR website, as well as all of the responses to the questions. Questions? I did remember one other point that we didn't include here about that I thought might be helpful. I have received emails from people who are interested in participating but not leading these. They come from one of them has a very large low-income clinic, a large population-based clinic in an area that is generally not represented in research. Another has experience in cloud-based platforms. So if people are interested in collaborating with with each other or anyone else, please let me know, and with their permission, I will connect you. Questions? So the question is when and how can we get the submission packages? Where? If you go to the RFA, and I can't pull it up in front of me right at the moment, but when you go to, if you read through the RFA, you will see links for the SF-424. So one of my colleagues here is being very, it is right before the table. It's required application instructions. There's a whole section on the SF-424. There's an application guide listed, and I actually had it in the slides earlier. And then there's apply online using Assist. And there's a button that you can actually push that will lead you to Assist. Please be aware that in these slides, I actually gave you a link for the instructions for Assist too. Thank you to my colleagues.
Someone notified me that you could come right in your email address.
Oh.
From the funding announcement as well.
Okay. So there is an error in my email address. There is a comma in it. So much for good intentions. I will have that corrected, but it's nilsenwj@od.nih.gov. All right. So in the overall section, please clarify if the letters of support and data sharing plan is supposed to fit within the 12 pages. No, they are not. They are an additional, and they are in addition to the 12 pages. Other questions? And I did want to say that there was a question as we were trying to standardize this presentation. We do have a transcript of the presentation that will be included with the slides. Other questions? Oh, so my colleague said, is this a one-time only announcement, or will it happen again? And the answer is this is a one-time only announcement. We hope to build this research. As we've noted, we're really interested in sustainability on this project. We believe that we've seen overwhelming support for the idea amongst our federal colleagues and and our industry colleagues. So there's a lot of a lot of excitement. And so what we're thinking is that this will be a sustainable project. All right, the next question is, will there be, okay, I did that one. Okay, so there's a question about sustainability, on sustainability. It says, will sustainability be from subsequent funded studies, such as NIH funds or pharma? And I think this is really up to the applicants to point out how they think this would be sustained. It can be sustained through a partnership. It may be sustained through a fee system. It may be sustained in part through NIH funds. You can imagine that studies using the project might have a fee that might be able to support it. I think any creativity you have in helping keep this project in creating a sustainability plan that is solid, we will be excited about. Sorry, we're working off multiple computers here. Can projects have an internal advisory board in addition to the external advisory board? Yes, of course. You can have as many boards as you'd like. Other questions? I'm checking email too. Nope. Okay. Can we have access to a sample successful application from before? As I noted, this is a one-time only application. There are no successful samples, and thank you.
something before that.
Okay.
Another.
Oh, should the application include the advisory boards, or will that be decided with the NIH after the project is awarded? So those will be decided after. Your NIH contacts will be decided at the time of the award, and the advisory groups will be put together after you receive the award. Other questions? And again, all these questions will be posted, as will the slides and the transcript. Other questions? Where will they be posted? They will be posted at the National Institute of Health, Office of Behavioral and Social Sciences Research. Oh, here we go. Our web manager just walked in, and she will actually type the web address. We can link it to that.
Okay.
Okay. So she will type the web address where it will be. And we will send out the link to everyone as well as the slides. Other questions? So the question is it a requirement that wireless carriers offer the free service as part of the application? As I noted earlier in our previous question, there is no requirement that you work with carriers. If you can figure out ways, if you can think through ways that you can generate a representative sample, a representative population to draw from for the registry aspects of this, we're encouraging anything you can do to really develop a system that includes a representative sample will be fine. Working with the carriers have suggested working with them, and I am not, but that would be up for applicants to decide. So the question is, will I be sending the transcripts with the slides? Yes, I will. We weren't just checking. We will actually do it. Okay. And we're looking for looking where we're going to put the slides. So. But we will send it all out. Other questions? What does the representative registry mean? Representative U.S. population or the global population? Thank you. That's a great question. For this proposal, we're looking for the U.S. population. If you wanted to make a case for the global population, you would be welcome to do that, but what we're really looking for at this point is the U.S. population. Other questions? Other questions? I'm going to wait a few more. We're just typing out a website right now. Again, we will send out a message after this talk. We will not have the transcript transcribed perfectly after this talk, but we'll send you most of it. Okay, we're posting the link where it will be right now, where the slides will be and the transcript will be. And that's, you will see that Nana Fari, our web manager, just posted it. Other questions? Okay. I'm not seeing other questions. Unless there's anyone that has any additional questions, I'm not seeing any in email. I'm not seeing any in the chat box. So with that, we will be done early, which I think probably is a record. But we will be posting the slide. We will be posting the slides. We will be posting a transcript. You can also email questions, and we will be adding those to the frequently asked questions. So we thank you for your interest. We thank you for your participation in the webinar. We know you have very busy lives, and we're very grateful for your work, your caring in this, and your help as we try to move this agenda forward. Thank you.